Welcome to Q&A, a program that raises questions and provides answers to issues important to the community. Today's discussion covers 3 hot topics for Massachusetts elderly and disabled. 1. What's happened to the 2006 Equal Choice Law, which provides home care options for the elderly and disabled? 2. The Massachusetts bed tax on private paying nursing home patients. And 3. The elder driver issue, a dilemma for both drivers and families. Our host is Sally Hoyt, Senate President and 16-year member of the Silver Legislature. Sally also served on the Reading Board of Selectmen for 12 years. And now, the discussion.
Good afternoon. It is a pleasure to be with you again today and to bring you another program on issues that affect the elderly and the disabled in Massachusetts. Our guests here today are Al Norman, the Executive Director of Mass Home Care, and Dan O'Leary, Executive Director of Mystic Valley Elder Services. My name is Sally Hoyt. I'm with a Senate President of the Massachusetts Silver Legislature and a former elected 12-year member of the Reading Board of Selectmen. We have had a nonstop advocacy program trying to work with the House this week and the week before, trying to get funding for our favorite topic and our favorite program, the Equal Choice Program. And I would like to call upon both Dan and Al to give us an update on what has been going on at the State House these last couple of weeks, and let us know exactly where we are on some of the other issues that you're going to be hearing about. Why don't I call on Al first and give us an update on the Equal Choice Program and how we were finally able to secure some funding after all the advocacy that we've had to do these past weeks.
Well, thanks, Sally. Thanks for having me on the show. Just to refresh viewers, in August of 2006, Governor Romney signed a piece of legislation that we had written that says that if an older person or a disabled person wants to get assistance, needs help in taking care of their daily living skills, that they have a right to get that care in the least restrictive setting. That's the key word. And we were very excited with the passage of this law because it represented a new direction in Medicaid, which is the largest funding source for long-term care services in the country and in Massachusetts. In fact, $2 billion of tax dollars in this state goes to providing care for people. And most of that historically has gone to nursing homes. So we wanted to turn that around and make it care in the community first. And the bad news was that since August of 2006, very little actually was invested in community-based care. But as of this point, we're more optimistic that eventually, it hasn't been easy, but we're going to have some additional funding to, for example, be in hospitals working with people who are on their way to a nursing home and telling them their options. The House is currently considering providing some funding to allow us to be in hospitals, to advise families, it doesn't matter what their income is, advise them about what their alternatives might be to a nursing home. And we think this is a great idea because it'll save the taxpayers a lot of money as well, at the same time keeping people where they want to be. We estimate that if we just take 1% of the people that we see and divert them into the community, we'll save the Commonwealth $11 million. So that's a pretty good deal. But it's been a tough battle this year because of reduced revenues. A lot of home care has been cut earlier this year, and we're just hoping that we can keep our lawmakers on the mark to give us the kind of resources we need to save money and to keep people at home.
Thank you. And Dan?
I'll just add to what Al was discussing. As an agency that serves the Reading, North Reading, Stoneham, Wakefield area down through Malden, Medford, Everett, and Melrose, we see people every single day that sometimes, frankly, have no other option at this point. When I say no other option, they're a little bit over income, they don't meet the Medicaid guidelines that Al was speaking of, and they're essentially being forced into nursing homes because that's where they can get the care, and they don't have the ability to get in the community. And what, as you know, Sally, as a strong advocate for the equal choice law, the whole idea was to help people reverse that, so that the first place to look to was the home. And we've made progress. You know, not to leave the viewers with the idea that nothing has happened. A lot of good things have happened, but we're not there all the way yet. And as Al mentioned, that still most of the money is going to nursing homes. We need nursing homes. I'm not denying that. I would like to see fewer, better nursing homes, frankly, more better home care, and that's what the public wants.
Sure.
So that's, you know, the challenge is, as Al pointed out, is that in this very difficult budget climate, where cities and towns are struggling, all human service programs are struggling, is making the right choice. Not to make a pun, but to
Sure.
the choice is that how do we spend the money that we have, the money that's going to be raised through whatever revenue-raising schemes the legislature comes up with, in a way that's going to give the public what they need and deserve. And hopefully this spring, as we move forward, and by the time this budget comes out, hopefully on July 1st, that the Senate budget will be at least as good as the final House version of the budget. And then the governor acts appropriately and signs the budget into law. So we have a long way to go yet, and it's like a baseball game. I guess we're in about the third or fourth inning of a 9-inning game.
True. I do want to say that it has been my experience that most of the people who speak to me do say that they would prefer to stay at home and receive home care services. However, we cannot underestimate the need for nursing homes. Nursing homes will always be needed for those people who need to go there, and there are people who must be in nursing homes to receive the care that they require. But for those who can remain at home and who can receive the care that they need at home, this is where most of our people want to be. I do know that we save a great deal of money by placing people in the community-based facility or their home. And what is the difference, the dollar amount that we can save by keeping, that is the dollar amount as to what it would cost, what we would save to keep people at home rather than to allow them to go to a nursing home?
Al can speak to the statewide issue, and then I maybe can add a little bit of right here in Reading and how that works locally.
Sure.
Well, just a quick number, which I think is pretty impressive. In the year 2000, between 2000 and 2007, the Commonwealth reduced the number of nursing home patient days by approximately 1.78 million days. And if you cost out what all of that care would have cost today, it comes to around $450 million. So we are saving the taxpayers almost $500 million in money that would have been spent on institutions. We in Massachusetts have dropped our nursing home usage by 17% since the year 2000. That's very dramatic. Among all the states across the country, we really are directing more and more people home. So this is a great success story that elected officials don't talk about a lot, but Dan can give you some of the local numbers.
I mean, for example, just in the greater Reading area, we'll call it, in the service area that Mystic Valley serves, right now, today, we have over 800 people who are living in the community who qualify for nursing home care. In other words, their needs are at a level that the state would say, you're eligible to go to a nursing home. We have over 500 people who are on Mass Health, which is Medicaid, nursing home eligible in the Community Choices program, enrolled in the Mystic Valley, and then 300 so other folks who are in what they call ECOP, the Enhanced Community Options Program, which effectively is the same program, but for folks who are a little bit over Medicaid guidelines. So you have 800 folks right now in our service area, just in this area, who are in the community at a cost, including essentially all the Mass Health services and the home care services they're getting, for about $2,000 per month, compared to the cost of a nursing home.
Sure.
So when you translate that out, Al said, that rolls up to hundreds of millions of dollars.
Sure.
And the great thing about this, Sally, and you know this even better than I do, is here's a program that works, costs the taxpayers less, and in fact is what the consumer wants.
Absolutely. Surely. Now, how about that waiting list? I know the last I heard, we had almost 1,000 people on the waiting list.
Yeah, it's been an unfortunate situation this year that as of the end of March, there were approximately 550 people on the home care list and another couple of hundred people waiting for enhanced home care, which is the next step up. Now, that shouldn't be. I think about those families that are having to be told you're on hold for home care at the same time that our doors to institutions are open. Now, that makes no sense in a state that says community first is our policy. I am hoping that with some help in the coming fiscal year starting July, that we won't just keep seeing those waiting lists get bigger and bigger, but it's been a struggle. It's absolutely foolish financial policy to be saying to people, you can't get into home care, would you like a nursing home? Because you've got to figure roughly 2 to 1.
Sure.
You can keep 2 people in the community for the cost of 1 in a nursing home. So it's a great bargain financially, and it honors the preference that people have of remaining at home. Right. So I'm hoping the waiting list will be gone, but right now we still have them.
We still have the waiting list.
Now, for the viewers in Reading, and again, the surrounding communities in the Mystic Valley area, we have a waiting list for people to getting enhanced services. So for the viewers who are watching this program tonight, I would urge them, though, pick up the phone and make the phone call. Because sometimes what happens when we talk about waiting lists, while they in fact exist, there's no question that they do, the public, the viewers think, then what's the point of asking for help? And that would be a tragic mistake, because even with the waiting list, and I 100% agree with Al, no one should be on a waiting list. No one should be waiting for home care, even though in fact it is true. It's a waiting list. The door is not permanently shut. So you may have to wait a week, 2 weeks, some short period of time before you're enrolled, because people, as we know, they leave the program. People pass away. Few people go into nursing homes, so there is turnover in the program. So the viewers, even though we're talking about this sad reality, please make the phone call, because help is available.
And would you please give them that phone number, 1-800?
1-800-AGE-INFO, AGEINFO. Now that number, the beauty of that number is no matter where you are in the Commonwealth of Massachusetts, that call will get directed to an agency like Mystic Valley Elder Services. So it's 1-800-AGE-INFO.
Wonderful. Do you wish to add any more to that, Al?
No, I completely agree that people, even in tough times, people need to apply. Don't ever assume that you're not eligible. There may be other programs we can help you with. And also they should be calling their legislators and saying that I think it's appalling that we have waiting lists for community-based care. These people have been paying their taxes for years and deserve some kind of return on that investment.
Yeah, I think that's a very, very good advice. Call your legislators. And in the immediate area, it's Senator Tassay, and he'll be right there, and his office is very responsive and is willing to help you at any time. The other program I'd like to speak, or have you both speak on, and I will as well, is the repeal of the nursing home tax on private patients. And I know that our viewing public has heard that issue before. I know that I have been very much involved in that bill, the repeal of the user tax on private pay patients. And many of the patients are unaware that they're being charged at this time approximately $12 a day, and it amounts to about, well, if we did our math, and I don't have my figures right here, but if you did your math, you'd certainly
it's about
figure out
$140 million a year.
$144 million this year. It's going up. It's going up next year, but
it goes up every year. In fact, I have attended the public hearings, and the public hearings is for the public to give their input as to why or why not, why they should not increase the user fee. And I have found that no matter what information I gave them, and I certainly told them that the private pay patients are not receiving any benefits from the state and federal government. They're paying for their care out of their own pocket, and so they're not a burden to the Commonwealth. And still, with that information, they still continue to increase the user fee each year. So I don't believe it's going to go away, because I did some research on it, and did find out that the fee was implemented during Governor Romney's administration. And what happened was that he set the fee on nursing homes for private pay patients. And what happens to that fee is that part of it goes back to the nursing home, and the balance goes back to the state, and it's matched by federal funding. And I think this is the reason that they don't want to remove it, because it brings back more funding from the federal government, and that does help the Commonwealth. However, there must be a way for us to overcome that obstacle. And I'm looking to both of you to tell me what are your recommendations as to how we can repeal this bill, because it's so unfair. And I feel that people who are paying their own way to live in a nursing home should not be taxed for their ability to pay.
Well, I'll just say this, Sally. The amount of money that's going into the bed tax for the year 2010 has been increased from $288 million to $440 million, so that starting in July, the cost for everyone who is not on Medicaid in a nursing home is going to go up. And it is a sick tax. I mean, you're absolutely right. It's a tax on people who have the unfortunate situation of being ill and in a nursing home, and they get hit with this tax. And you're absolutely right also that they don't know it. Most people don't see the itemized bill and have no idea that they're paying, in essence, a surcharge. The problem here is, unfortunately, not just state, it's federal, because this is permitted under federal law. And so it's really going to involve Congress as well. I mean, the state could say, we don't want to take advantage of this program and we're not going to charge people. But the problem then is that they're going to be saying that the nursing homes would say, well, we've got a $440 million hole then, and somebody's got to fill it. I think the answer is to start seriously improving our ability to move people out of the institutional stream and get them back into the community, which we're not fully exercising. I mean, I mentioned, for example, this nursing home pre-screening program that the Commonwealth, the administration has been unwilling to put any money into. We've requested $5 million from the legislature, but this is to make sure we know that 80 to 90% of the people who are in nursing homes come from hospitals first. So we should be there, and we should be in the hospitals helping to divert them into the community. That lowers nursing home patient days, and that lowers the need to spend more and more money on nursing homes. I mean, to some degree, we have to break the cycle of increasing rates for nursing homes, increasing expense to the private pay consumer. And one of the ways to do that is just to keep driving down the number of patient days. But it's a complicated issue because the federal government is involved and because the public knows absolutely nothing about it.
Sure. It is factored into their bill, and so therefore they don't see it.
Right.
But I have heard from people who have found it and who have called the nursing home to find out what is this charge, and they were told the truth, that it was the user fee.
And frankly, in some ways, it's in the nursing home's best interest to tell the consumer that this is not part of money that is directly benefiting the nursing home. It's a tax essentially by the Commonwealth. So in some ways, there's no incentive for the nursing home to hide it. And as Al said, I mean, the reality on this is it's a source of revenue for the Commonwealth.
Well, of course
and
it is.
It's a tax, a bed tax, a sick tax. And there's discussion, like with many other things that we're talking about this spring in 2009, revenue there's a discussion about essentially doubling the bed tax for next year's budget. So not only is it a burden for private pay person right now, it could become an increasing burden for them.
Sure.
I want to be clear that this money does go to the nursing homes. I mean,
Part of it does.
Well, predominantly. I mean, they're complaining that some of it doesn't, but predominantly this is a revenue-raising mechanism that allows the Commonwealth to have the money that's raised privately from these individuals get matched by the federal government. But it's a significant source of revenue now for the nursing homes. So they're not about to give it up. This is something that they're committed to. They don't like to talk about it. They don't like to talk about how private pay people are the ones who are paying for basically the services to other people. But I just think the mechanism is wrong. The idea of a sick tax is wrong. I'd like to talk about other ways that we can finance the services that we need besides singling out one category of people who don't happen to be poor enough to be on Medicaid.
Sure. Well, it is unfortunate, but as I say, I keep refiling the bill every 2 years, and I'm still doing the same thing, but I don't intend to give up. I think perhaps now I should contact my congressman and see what he can do to help us. But I think the public should also be involved, and if they have loved ones in nursing homes who are being taxed because of their ability to pay, that they should make their voices heard. And it's the only way that you can change things.
Right.
So be sure to call your congressman. And in this area is Congressman John Tierney. And in fact, Congressman John Tierney's office is represented at the local senior center once a month. So if you read your pleasantries, you would know what day a representative will be in Reading, and I would suggest that you take it up so that even if you don't have a family member in a nursing home today, and you might in the future, I think this is a good time to bring it up so that we can work together in order to try to get rid of this tax because it's so unfair. I know it does raise a great deal of revenue, and it certainly is very obvious that it does, but there's a time when we should look other ways for replacing these funds.
Yeah, something more equitable.
Surely. Okay. Well, why don't we talk about, well, I don't know if you want to talk about the bills that have been filed to retest elderly drivers. I know that's a very sensitive issue. And, but we can say a few words on that. I know that no matter what you say, someone's going to disagree with you, but we can tell you that there are bills in the legislature that are going to set up a committee to decide how they should go about retesting elderly drivers. I, for one, know that as soon as the bills were filed last year, the seniors across the Commonwealth made their voices heard. Our legislators listened, and they just backed off. They wouldn't support any bills unless they saw a commission formed that would study the issue and try to determine the best way to go so that it would be fair. And as many of us know, senior drivers only represent 19% of the population. And so who would be causing the accidents? 81% of the population. And so I do feel that most of the accidents are caused by other drivers other than seniors. But of course, when a senior has an accident, it's generally a serious one, and everyone is shocked and listens to what should have been, that is, what laws should have been placed in order to prevent these things from happening. But it happens every day to a driver of any age, and so we can't just say that one age group is responsible for the problems we have on the roads. I know personally myself that I feel that if a person has problems with vision and has problems with their health, certainly if they go to, once they see their primary doctors or their specialists, whichever the case may be, and the doctors determine that that person has a medical condition that would have an effect on the person's driving, that possibly that would be the area that they might consider making recommendations to the patients. But I think there will be laws set up that will address this issue and will make it easier for us to live with so that we don't have to make the decisions. But how do you feel about that?
Well, I'll give you a one-liner. We were talking about this before the show, but I think that an impaired driver of any age is a risk to the public safety.
Sure.
And none of us want people on the road who are unable to safely operate a vehicle. That is not something that is the exclusive domain of elderly people. There's a lot of people in their 30s and 40s who can't drive very well at all, and they may have some impairment. Could be vision, could be a stroke, whatever. But we've got, we could have a system where a physician is required to notify a driver or the RMV if there's a change in medical conditions of a person under their care that they believe would impair their driving, and then have the person take one of these simulator tests that indicate whether in fact they are a good, they don't have to be out on the road, a computer test to show whether somebody's impaired. And that person may be 40 years old. And I don't particularly want my kids out on the road with that driver. And I don't really care what their age is. So I think we have to first of all just strip it away from being an elderly issue and just look at it as a public safety issue.
That makes sense.
Yeah, I'm in total agreement. And again, as we chatted about this a little bit before, in terms of the simulators, I think that's a good objective way to do it, because right now, physicians there isn't any standard that they use to make a judgment about is somebody able or not able to drive. They make a medical judgment, but that may not be consistent from doctor to doctor. So using some kind of a simulator, as Al talks about, I think is a good thing. I think the other challenge we have, and it's not the physician's role necessarily, or even probably the Department of Motor Vehicles, but we are a driving society for the most part, unless you live in very high-density urban areas and used to taking cabs, and there is public transportation available and other alternatives. We live in a car, automobile-focused society. So the challenge is if you take away somebody's ability to drive, particularly if they have limited family supports or neighbors that are available to them, how do they live in the community? So here we are today talking about home care and keeping people at home. Transportation is one of the essential elements of home care. It may not, to the average viewer, when we think about home care, you might not think about that as, wow, critical to remaining in the community. But how to get around, how to go to get your food, grocery store, how to just simply visit maybe a spouse in a nursing home, or a friend down the street, how to get your hair done, how to go to the doctor, all of the activities of daily living, how to work, how to volunteer, how to do all the things that you and I fortunately are able to do. How do we get here today?
Sure.
That's all a transportation issue. So transportation and driving is such a difficult, complicated subject that simply just saying, okay, we're going to take away somebody's right to drive, while it may be a public safety issue, and I do agree with Al, we also need to think about what happens to that person after we take away the automobile, after we take away their license.
Surely. Well, I do have a couple of responses to that, and the first one is that for people who live within the MBTA area, we do have the ride if you qualify.
If you qualify.
If you qualify, you would have to do, you'd have to fill out the application and have it reviewed and approved. Right. And the other thing is, and this is where volunteers come in into play, and the volunteers are so important to the communities. I know in Reading we have volunteers who drive patients to nursing homes, and that has been a great help to people in the community who are unable to drive and who cannot drive. So I think that is the beauty of having volunteers available for us in the community.
Right, right. I mean, no matter how good government programs are, how good Mass Home Care and Mystic Valley Elder Services, the reality is we absolutely could never do it alone. I mean, what has been said for years is true today as it was 25 years ago. 70 to 80% of all the care delivered is delivered by family and friends. So agencies like Mystic Valley Elder Services and other support systems play an essential and an important role, but cannot do it alone. And I know that we're running out of time.
Okay, go ahead.
Well, that concludes our program for today, and we certainly hope you've enjoyed watching us and listening to us. And we will again bring you another program in the future with information that might be of help to you with regards to programs that affect the elderly and disabled in Massachusetts. Thank you very much. And thank you.
Pleasure to be here.